Welcome to my poster on longitudinal prediction of motor dysfunction after stroke, a disconnectome study. First, I want you to imagine or recall a situation where you see a patient with a stroke. According to statistics, that patient will most likely exhibit motor dysfunctions like partial paralysis of hands, for example. So when you see this patient, will you be able to tell if this patient is going to recover, for example, in 1 year? Probably if you are an experienced clinician, you might have a good guess. However, it might be useful to have a tool that will potentially provide supportive evidence for your decision, which would allow you to adjust the rehabilitation in future. So in this study, we propose such a tool that predicts motor outcomes at 2 weeks, 3 months, and 1 year after stroke. So how did we do that? We had a data set of 62 patients, stroke patients at acute stage. Using BCB toolkit, we generated for each patient disconnection patterns. Then to reduce the dimensions, we mapped each patient's disconnection pattern onto a space derived from an independent large dataset of ischemic stroke patients, which is called disconnectome, and it consists of 46 components. This procedure gave us the patient's estimated score of each component. Then we used those estimated scores to predict 2 motor components for the left and right side of the body at 3 time points. We used here ridge regression, and we optimized and externally validated that model. So here we can see the results of the ridge regression on unseen by the model data. The disconnectome approach allowed us to improve the prediction precision of motor outcomes at acute stage in comparison to previous study that used the same data set, and they also used the ridge regression at acute stage. In addition, we extended the results for long-term predictions. We went further and looked at the top 3 components in the ridge regression that were significant contributor in explaining the variance in data. So, for example, the right inferior frontal gyrus was significant contributor for the left motor impairment, starting from 2 weeks to 1 year after stroke. And we see that disconnection patterns vary across time, and they involve areas beyond motor cortex. So here are my take-home messages, and I will be happy to discuss in more details this project with you. Thank you.